first. My name is Chaya Murali. I'm a pediatric genetics physician at Baylor College of Medicine, and I've had the pleasure of working with TANGO2 families for a few years now. And I'm one of the PCORI stakeholders for the TANGO2 Foundation. I'll let Kasha introduce herself now. Go ahead.
Yes, I'm Kasha Morris, and I have a son, Ryan, who is 22 years old, and he has TANGO2.
Mhm.
And really, it took about 16 years for him to get a diagnosis. Finally, when he was 16, he was diagnosed with TANGO2. He had never had a crisis, but he had many other of the episodic and spell-like symptoms that TANGO2 children experience.
Mhm.
And he does have an intellectual disability that was evident from an early age, gait issues, speech issues,
Yeah.
and so many of the other non-crisis symptoms that many TANGO2 children have.
Okay. Well, thank you for telling us a little bit about Ryan. So, I wanted to ask you, how does caring for a child with Tango 2 affect your day-to-day life or your family's day-to-day life? And how would that compare to a person who's not caring for a child with Tango 2?
Well, right from the beginning, it was clear that Ryan needed care that was not typical. Um, and when he was having episodic spells and or poor energy, he couldn't do the things that his peers were able to do.
Hmm.
Throughout the years, he had shortened school days. He couldn't do a whole day, didn't have the energy for it, would often have to get picked up early. When he was not feeling well, it would take days, sometimes weeks, for him to get back to baseline. So all along there was always things we worried about for Ryan.
Right.
When we got the diagnosis, we had always wanted that answer, but we ended up with more questions than answers with the diagnosis of TANGO2. And even as we learn more about TANGO2, we still have to be so diligent about Ryan's day-to-day health. Um,
Hmm.
you know, is he eating enough? Is he eating well? Is he drinking enough? Um, is he sleeping enough? Is he safe? If he has a spell or an episode, is he in a safe place? Will people recognize that and be able to care for him safely?
Hmm.
So a lot of the things that families have to deal with are just magnified with the diagnosis of TANGO2, because we now know that if Ryan gets sick or he's not eating enough or he's not drinking enough, it can go to a life-threatening situation very easily in terms of a metabolic crisis or life-threatening heart issues.
Right.
So that extra diligence, especially when he is sick,
Hmm.
we always have that fine line of, okay, he's not feeling well. We really have to up the monitoring of what he's able to take in. If
Hmm.
he's not able to eat and drink, we have to make that call. Do we go to the hospital? Does he need IV fluids or nutrition in that way?
Yeah.
Um, so I kind of describe it as, when you have a child with TANGO2, you're pretty much daily are on a high alert, and really in tune to what they need. And even though
Right.
now we know B vitamins are very helpful to our kids, the reality is B vitamins don't taste good, they don't smell good,
Oh, no.
and it's a daily battle to get them to take them. So
Mm.
here's this supplement that has profound impact on the quality of their lives, but you got to get them to take it. And
Right.
so that's a battle that we face, and it has severe consequences if we can't figure out a way to master it. So you have to
Right.
be diligent, you have to be creative, you have to be patient too, with a child who has an intellectual disability. That makes all of these things a little more challenging and difficult too. So it's a
Absolutely.
challenge, but we're glad we have a diagnosis, and keep learning a little bit more and a little bit more. That helps to try to take away some of the intensity, some of the fear
Yeah.
um, that goes with it.
Now, you mentioned kind of getting the diagnosis almost opened up more questions than answers, and you've alluded to a little bit of that already here. And I wonder how those questions kind of feed into your concerns that you might have about Ryan's future?
Yeah, that's a big part of it. That Ryan's 22. Um, there's maybe a small handful, maybe 5 or 6 individuals older than Ryan that we know of in our community that are diagnosed with TANGO2, and they're in their late 20s, maybe 30, 31 at the most. And
Hmm.
so we don't know the future. We don't know what symptoms are going to look like for Ryan in a few years from now. Will they get worse? Will what skills he has, will he lose them? Um, is Tango 2 neurodegenerative? Some of the research uses that word. So,
Right.
will he lose his ability to speak or to walk? There's so many unanswered questions, and we don't have another family to go to and say, hey, what's it going to be like when Ryan turns 35 or 40 or,
Hmm.
you know, and beyond that. So the future just is an empty slate. We don't know what it looks like. And Brian and those handful of others are going to be the ones that, navigate that first.
Right. They're going to write the textbook, sort of.
Right.
Yeah, but I think that uncertainty is something that so many rare disease families bring up, and that's one of the hardest things. Even before the diagnosis, there's uncertainty, and even after it remains, which is a little bit bittersweet, isn't it? Now, speaking of kind of, hopes for the future and thoughts about the future, one of the things that's going to keep going into the future is research. And I know that the Tango 2 Research Foundation has partnered closely with scientists and physicians about Tango 2 research. What are your hopes, or what do you hope that people will focus on in their research, and what do we hope we'll discover as we continue to learn more about the diagnosis?
I think initially the biggest hope, of course, is, can we prevent the most life-threatening symptoms of Tango 2?
Mhm.
And I think we've made some progress there in terms of the B vitamin supplements. There is some research showing that that can help keep kids out of crisis or help improve um, how kids are doing when they're in crisis. So, but that question is always, is that enough? You kind of just want more reassurance. Is that truly enough to keep them out of crisis? Will it always work?
Yeah.
So more clarity around that. It's wonderful that we've made that progress, but it still needs to get a deeper dive in terms of preventing that. And then, after that, the whole quality of life piece to Tango 2. We need research around that. What can we figure out about this disease, about some of the spells and those episodic symptoms that kids get first when they're younger.
Hmm.
Um, what can we do about that? Because they have a huge impact on a family's quality of life. The intellectual disability piece is has a huge impact on a whole family's quality of life. So, putting some attention in those aspects too. Their mobility, the ataxia or dystonia, those kind of symptoms, can we prevent them as well? Or what can we do to improve them for our kids?
Yeah, it sounds like there's almost kind of day-to-day kind of low, not lower level, but more active ongoing issues, and then also those bigger picture concerns, and those both feed into your quality of life and your lived experience of a parent of a child with Tango too.
And, Ryan has not had seizures to this
Hmm.
point. That's probably goes to that question of, you know, concerns for the future for him.
Yeah,
But many kids with Tango 2 do have seizures. So putting some research towards that, why do some have them and some don't?
sure.
Is there research that could go on to try to get it so that none of the kids do? I don't know. But that's another big part of this. And just another area is I'd like to see more effort in is earlier diagnosis.
Hmm.
It took 15, 16 years for Ryan to get a diagnosis.
Right.
And I don't want other families to have to go through that, especially now that we have B vitamin supplements that can have such and make such an improvement for the quality of their life.
Yeah.
So, you know, is there a way we can get a diagnosis quicker and faster for these kids before they're having symptoms that impact their quality of life so much, and especially before they're in a crisis.
Yeah. And it makes me think, where do kids with Tango 2 interact with medical providers? And which types of medical providers can we provide more education to about Tango 2 so that they can recognize it? Because I think obviously the pediatricians are seeing these symptoms a lot, but it's such a rare disorder that if they don't see it more than once in their practice, they might not recognize it. So how can we improve that?
And I
Yeah.
think it's would be very rare for a pediatrician to see more than one. So yeah.
Yeah. So we're kind of nearing the end here. Are there any other final thoughts that you wanted to leave us with?
I just think that it's as you like I said, we wanted a diagnosis, we got the diagnosis. Now we want more. We want to prevent the life-threatening symptoms. Okay, we're getting there. Now we want more. There's a lot of work to be done. It was only discovered in 2016. There's a lot still left to be understood and known about it, but heading in the right direction. And I'm hopeful for the future that things will improve.
Me too. Thank you so much, Kasha.
Thank you.